Hey guys, it's Maggie and I am back today, and today is a week after my surgery, so I thought I would talk all about the surgery, everything that's happened since, basically day by day, and yeah, clearly I'm feeling better. You guys will have to be the judge of my voice and tell me if I sound better or if I sound worse or about the same. I am still a little bit nasally, and I was told after surgery that they put foam packing in my nose. I am not completely convinced of that because I actually can't feel it. I can't see it. I have no idea if it's actually in there, but I do have a follow-up where I was told it would get removed. So I guess we'll see then. We'll see in a few days if anything's up there. I'm very curious. I feel stupid, like I should be able to feel it. I still have like a small amount of pressure right here, but it's just nothing compared to what I felt before surgery. Oh, by the way, when I was talking about some spooky things happening in our house, some of you guys are pointing out this picture, so it is very reflective of our windows and they face the street, so anybody who rides by on a bike or walks by or drives by will probably appear in there. So not any spooky ghosts, but that's not to say that spooky things have not continued. Anyways, yeah, so immediately after surgery, you guys saw the couple hours after, and I did continue to have some bleeding. In fact, a week later, I had a little bit of bleeding this morning. Basically, I was advised to rinse my nose out 3 to 4 times a day with distilled water. Just want to make sure you guys knew that, because some of you were like, make sure to use distilled water. I am, don't worry. And the little salt packets that come with the little neti pot thing that I use. And I don't know, I'm not getting a whole lot, but I did clear out some stuff. It's like I got the rest of the infection out, and now it's basically clear with tinges of blood here and there. Sometimes I'm getting like dark old blood clots, but they're becoming less and less. It took a few days for my voice, I think, again, tell me what you think, to return to normal. My throat feels completely fine now, so that's great. I noticed pretty much right away that I can breathe again. Like, it is wild to me that I can sit here for hours without having to blow my nose and be able to breathe out of both nostrils. I forgot what that was like. I haven't done that in years, I think. It totally blows my mind. Like, look at this. I feel like I was making really hard eye contact with you, but I can breathe through my nose from both nostrils. Like, you guys have been walking around doing this? This is crazy. So yeah, I think that's wild. And of course, I'm just curious. So I took a flashlight and looked up my nose. They are caverns. I could go spelunking in them because of how large they are now. I have never seen my nose not swollen, or at least not for a very long time, because I used to look up my nose because it was bugging me, and I think it's called the turbinates, were swollen on the sides. So I would be able to see like these kind of mounds come out from the sides, and my right side most of the time couldn't see anything. Like, it was just completely blocked, which is why I could hardly breathe from this side. Now, I do want to say, with my sinus surgery, some of you guys were talking about how horrible yours was and how painful. I did not have a surgery on the septum. Now, I do have a deviated septum to the right, which makes sense to me now, all these years later. When I did tube feeding, they always tell you to rotate sides. My right side was always painful. It always felt more closed, so I just stopped doing the right side, and I always had my tube in the left side. Now that makes sense to me because I did have a deviated septum, but it is very minor, and my doctor asked me, do you feel like you can't breathe on the right side? I said, sometimes, but sometimes I can. And he was like, yeah, we're not gonna operate. So I didn't have anything done to the actual septum. Basically what they did was they took the tissue from the opening of the sinuses, which included apparently bony tissue. They took out some bone to open it up. And then I got my results from, I guess it was surgical pathology. Whatever they cut out of you, they send to the lab, make sure it's good. And not like cancerous, although there was no indication that that would be a thing for me. But yeah, they said that they got bony tissue, and they also got 1.7, I think, on the left centimeters and 1.8 centimeters of turbinate tissue. That's wild. That seems like a lot to me. Like, that's a pretty decent size. So yeah, I can see it. At least I think I can, or at least the infection being cleared out made it so much less swollen. I'm just truly, like, I'm not trying to get ahead of myself, because I know all too well after surgery that things can go wrong. And there were a few things that I was worried about, the leading days after the surgery. But this has by far been the easiest recovery and the fastest results. And I'm not even out of the woods, because supposedly I have packing in my nose. But with packing in there, I can breathe. And I haven't felt like this. And I'm getting my energy back. I feel like my face looks back to normal. I look like rosier. I did put blush on, so I'm cheating a little bit. But I feel like I look together again. And I feel together. So I'm starting to like clean the house. I let the house go, because I felt so sick beforehand. I just felt, it's like when a person gets a cold and you just feel like you need to take a couple days off to relax and not do anything. And that's how I felt for 7 months. I just felt sick all the time, and I was like, well, this isn't reasonable. I can't pause life for over half a year just because I feel sick. So I didn't. But it wears you down. So now I feel like, okay, I'm clearing this infection. That doesn't mean I won't ever have a sinus infection again. Not by any means, but it means that should I get another one, I should be able to clear it way easier, or like have the possibility of clearing it. So that's one of the things I'm going to ask at my follow-up is, should I get another sinus infection, what's the plan? Do I go to my primary care and get oral antibiotics? Should I come to you to do antibiotic nasal rinses? Oh, and that's something else. A few weeks ago, prior to the surgery, when I saw the ENT, he had told me originally that I would be doing antibiotic rinses, but then when I actually had the surgery, he did not order that for me. I think what he's doing is seeing basically, can I clear it on my own? Like, can I get rid of this infection? And in the 2 days after surgery, I was getting some infectious, some bloody, looking sputum. We'll call it sputum infection. I think every nurse has their bodily fluid that they can't handle, and mine is anything relating to mucus. Nope, can't do it. I would gag. When I had to suction patients. Can't. But anyway, I had what was infectious coming out, just little tiny bits, because he had cleared most of it, and now it's just clear with tinges of blood. So it's crazy. I am still swallowing a little bit of blood. I take a flashlight and look at my throat. So much less though, which means that the nausea I was having beforehand, gone. I was really, really worried. I was so worried that the nausea I was having was not related to this. And I was like, I don't want to have the surgery and afterwards just still be nauseated and not have a cause. So I'm pretty sure that that's what it was, because it's been gone. The one thing that I was a little concerned about after surgery, and this is what they told me to look out for, was a fever, sign of infection. I tend to run low. Like when I had my appointment with my primary before the surgery, I was 96.5, and that's pretty regular. I run 96.5 to 97.5 Fahrenheit. And I was running around 98, which is high for me. Like, I feel a little off when I'm around 98 or higher. And I did get to 99 after surgery. They told me, I think it was like 101 I should contact, or 100.5, something like that, I should contact them. And I was like, okay, never hit that. The highest I got was 99.1, but I feel it. And that's why I was checking my temperature, because I can feel when I'm 99 or higher. I just don't feel good. I feel fevery. But at the same time, I realize if I call them with a 99 fever, it's not a fever, they'd be like, you're fine. Like, call us when it actually hits the number we told you. So I just kept monitoring it, made sure that it didn't go any higher than that, and took Tylenol, took Advil, because they told me I could take that. Advil? Yeah. And yeah, it seemed to go away. My temperature seems to be back around 98. It's still a little higher than I normally am, but I haven't felt fevery in a couple days. So that's really good. I'm just like looking at myself in the monitor over here. I just look better. I look better. I feel better. I'm amazed. So we will see. I get the packing out in 2 days. And follow up with the doctor. I'm going to ask him a whole bunch of questions just because I'm curious. I want to ask about the bony tissue that they pulled out. It's like they shave it down, I guess, in the opening. Isn't that crazy? I was trying to tell Zach that, but he just does not like anything with the nose. And some people have asked in my videos, they're like, Zach sounds nasally too. He is. He has always had nasal problems. He's always been nasally. So that's like his regular voice to me. But yeah, he just doesn't want to get anything done. I don't think that he has a sinus infection. I think that he just either like a deviated septum or something. I don't know. But yes, he does have nasal problems. He will sound nasally probably all the time. That's just how he is. But yeah, I was hoping that I would have the surgery done and be like, look at how easy it was, look at how great it was, and convince him to go, but I don't think that's gonna work. Meanwhile, he is fine with anything teeth. I hate the dentist because every time that they give me Novocaine, it does not do a dang thing. I feel everything. I had one time where they gave me 4 shots of Novocaine to do a filling. I sobbed the whole way through. So anyway, I haven't been to the dentist in a while, and I don't like to admit that because I do need to get my wisdom teeth taken out, and that's something else I want to get taken care of. But I have to go see an oral surgeon. I just don't want to, because apparently one of my wisdom teeth is along the artery in my jaw, and so a regular dentist won't do it. And I actually found a dentist who will knock me out for all things. I don't even like getting cleanings because I'm just so afraid they're going to hit something and I'm going to feel it really bad. And a lot of patients say that they have a high pain tolerance, and I don't know if I do, but I would say that I've had decent amounts of pain where I can find easy ways to manage it, like breathing and heat and things like that. Pain with teeth is just on another level. I would compare it to when I got my stitches out from the proctocolectomy. Like, it just hits nerves, and I hate it. So yeah, that's the next thing I want to get taken care of, and I want to get back into a routine with teeth. And basically I'm just gonna be knocked out for everything, or they're gonna give me drugs or something, because I found a dentist who will drug me up, and I know that sounds horrible, but I'm anxious. Like, cut me open in my stomach, I don't care, that's fine. We can handle that. Teeth, nope, don't you come at me with your things. I don't know, what a dentist use. But anyway, off track. So, yeah, things are going well. I'm very excited. I'm so eager to see if there's packing up there. I just can't tell. I have no idea. I can't see anything either. I looked up there, but I guess it would be pretty high up, right? I don't know. But I will take you along for that too, and that's gonna be a couple days. So that day is actually supposed to be really warm, and we went to Goodwill, and I got some new dresses and some, well, new to me, dresses and clothes, and I just want to like feel like myself again, dress up. I actually got this shirt. Oh, I love this. This is the second time I'm wearing it, but don't tell anybody. Yeah, I feel good. I feel like I'm getting back to myself. And then that leads to the anxiety stuff. So when the bleeding slowed down, I was like, okay, I feel like I'm at a good point where I'm not really at risk of bleeding out from my nose. So I did start the Zoloft and the Buspar. I don't think it's called Buspar anymore. I think that's the brand name, and that's like, now it's just generic. But I'm going to say Buspar because I can't say what it's actually called. I can't pronounce it. Busparone or something. I don't know. I know I should know, but I don't think I ever even gave that medication. Actually, I don't think it's approved for anybody under 18. I don't know. I don't know what I'm talking about, so don't listen to me. I am titrating upwards on my doses, so I'm taking 25 milligrams of Zoloft, and I told the doctor like that didn't seem to do anything, and we went to 50 the last time I was on it, but I still didn't feel like it did anything, and she said, that's okay, like we can go up to 200. So, started that. I'm still on 25. In a day or two, I'll bump up to 50. And then the Buspar, when I was told to take it as needed, it was meant more so as a long-term, short-term, that doesn't make sense. Kind of like use it for a couple months every day to kind of help with the extra anxiety, and then when things calm down and I feel better, I can kind of come off of that, like wean off of that and just be on the Zoloft. My hope is that I won't need them, either of them, in the future, but it's nice to kind of help bridge now and help keep me calm because I still feel anxious some days. Like yesterday morning, the only way to describe it is it feels like you're gonna have a heart attack, like your heart is gonna pound out of your chest, and it gets a little bit hard to breathe. So yesterday morning, I was feeling good and I was trying to do stuff. For whatever reason, I decided to take all of the handles off of our cabinets to try and clean them, and now they look worse, and they look, I'm wondering if they were silver and I was cleaning them with water, and now I'm like, they look cheap. I thought I could clean them with vinegar and water. I don't know. Anyways, I was doing that, but throughout the whole time, I had to keep pausing and like taking deep breaths because I felt so... Right now I feel okay. Right now I'm good. But yeah, I'm actually taking a lower dose of the Buspar than what I'm taking half a tablet because I can't tell if it makes me feel a little funny or not, like a little loopy. I'm not sure. That might not even be a thing, but I felt a little loopy the first time I took the full dose, so I was like, let me just take 5 milligrams in the morning and 5 at night. And then I take the Zoloft at night because I'm just gonna like be careful with it. I don't know. I'm just being very cautious. I was told to take it 10 milligrams, one tablet, 2 to 3 times a day. And like, I'm small. Like, I'm small. I know that. Let me start with a little less. Anyways, I'm going to keep my doctor updated because that's the plan as I titrate upwards. And if she told me to go to 75 on Zoloft, but then I looked at the instructions and it only says 50. So I'm going to see how I am on 50. If I'm fine on 50, I'll keep going with it. If I feel like it's not doing anything, I'll contact her and say, let's do 75, or ask her if she thinks 75 is good. I mean, she already did. She said we can go to that if you feel like it's not working. But, you know, just to confirm with her. So, yeah, it'll be very interesting. And it's kind of funny. I don't think I've mentioned this before on YouTube. But when I was younger, I would have what I could only explain as panic attacks. But I lived with a very traditional father, Panic attacks were not a thing. But now, obviously, my dad has seen me through all of this, and he has changed his tune with it. But I kind of grew up thinking, like, that's not a real thing. Like, you're being dramatic, and it's wrong. And the first time that I was hospitalized for Crohn's, that was when I had an obstruction from my rectal stricture. And it happened twice. No. It only happened once, that admission, and then my second admission, it happened. So it only seemed to be around the hospital. But the first time, I felt really bad. I was very mean to a nurse, and my dad was very mean to a nurse. Kind of understandably, but also I would be ticked if I was the nurse. There was something, I remember the nurse coming into the room. She was very nice, very sweet, totally did not deserve this. But she came into the room and she needed me to do something. And whatever it was, got me going. I'm gonna guess like an enema or something like that. Got me going, and I was upset. And I started crying. And the nurse kept pressing, like, no, we gotta do whatever it was, we gotta get it done. And then I started not to be able to breathe. And she's a nurse in the hospital, and when your patient can't breathe, you don't leave their side. But the problem was, she was the reason I couldn't breathe. So I felt like I was suffocating. And I had that before. It was generally when I got upset over something and somebody tried to console me or, like, I don't know, comfort me, it would make it worse, and then I wouldn't be able to breathe. But I'd never had it this bad where it literally felt like somebody had their hands around my neck. It was awful. And so my dad wound up having to scream at her to get out, and she left finally, and I calmed down and I was fine. But obviously she didn't want to leave her patient who could not breathe. But it was her, whatever it was, her approach or something made me upset, and I couldn't breathe, and I feel so ridiculous for it now. And then the second time it happened, I had rhinovirus, and it was right before my first resection. And I got really sick. I don't know why I got really sick, but I was hospitalized. And it was towards the end of my admission. I was doing a lot better. I was totally fine. And I was actually sleeping when this happened, but they still had me on the monitor. They had the pulse ox on. And I woke up to not being able to breathe. And my pulse ox was like 85 or something like that. I felt like I was suffocating again, and like I wasn't even crying at the time. I just woke up to it. And I guess they kind of chalked it off like, well, she did have rhinovirus, so maybe it was that. And it wasn't that. It wasn't like I was stuffy. It wasn't like my lungs were really junky. I just couldn't breathe. And then my dad kind of helped me breathe through it, and it calmed down, and I was fine, and my oxygen went right back up. So over the years, I kind of like learned, you know, okay, just kind of ground yourself, realize you are fine, nothing's happening, you're gonna be okay. And I could calm myself down and kind of get rid of that, but it keeps creeping up lately. I noticed it really bad when I had that really bad stomach ache after Qdoba. And I told you about that, where I got really sick, I threw up. I was struggling to walk up the stairs because I felt so faint, and I was like, oh my god, am I gonna, like, do we have to go to the hospital? And I started to feel it come on, and I was like, oh no, this is not the time to not be able to breathe. Let's keep it going, Maggie, you gotta calm down. So I had to remind myself, like, you're safe. Yes, you're in pain. It's stomach pain. These things can be handled if it comes to it. You've got your husband who will take you to the ER. There are ERs close by. You've got your dad if you need him. Like, you're going to be okay is essentially what I had to tell myself. So yeah, but hopefully this medicine helps. Hopefully that can kind of kick that in the butt, and I mean, it's nothing like feeling sick already and then not being able to breathe, but and I did grow up with asthma. They thought maybe it was asthma, and looking back, no, it was like I was upset. So anyways, that's the update on that. I figured I would just keep you updated on the medicines and how it's going with them. If you're interested, I don't know. I don't want to be over dramatic with them, be like, I have anxiety, oh my god. I just, I realized I was struggling, and I am nervous to take these medicines, and I know I'm not the only one, so if I can share that, we'll talk about it. We'll see what it does to me. But anyways, yeah, so really looking forward to hopefully getting some relief from that. I can breathe. The pollen's coming on, so I'm sure the allergies are going to kick up. This is like the perfect time of year to get this tested out, because with a stuffy nose from pollen, sinus infection could come on real easy. So hopefully it doesn't. Clearly I'm excited that it feels like this. I'm just glad to be on the other side of it. So how cool is that? It's done. You're done. And that's what I tell myself before surgery. I'm like, it's gonna be 5 days from now, and it's gonna be over with, and you're gonna be fine. Here I am, a week later. I'm good. Like, I'm fine. Optimistic, but obviously real. We'll see how my next appointment goes. But yeah. What happened to my hair? Good grief, Maggie. It's because I flip-flopped it all over the place. Anyways, I hope that you guys are feeling good. Thank you so much for watching, especially with the premieres and live chatting with me. I always get nervous before I do that, but you guys are very supportive and just nice. So, all right, I hope that you are feeling good, and I will see you in the next. Bye, guys.